Tetanus, also known as lockjaw, is an infection characterized by muscle spasms. Spasms may be so severe that bone fractures may occur. Other symptoms may include fever, sweating, headache, trouble swallowing, high blood pressure, and a fast heart rate. In those who are infected, tetanus immune globulin, or, if it is not available, intravenous immunoglobulin (IVIG) is used. The cause of the disease was determined in 1884 by Antonio Carlo and Giorgio Rattoni at the University of Turin, with a vaccine being developed in 1924.
Back muscle spasms often cause arching, called opisthottenose. Sometimes the spasms affect muscles that help with breathing, which can lead to breathing problems. Prolonged muscular action causes sudden, powerful, and painful contractions of muscle groups, which is called tetany.
These episodes can cause fractures and muscle tears. In neonatal tetanus, symptoms usually appear from 4 to 14 days after birth, averaging about 7 days. The first sign is trismus, or lockjaw, and the facial spasms called rhesus sardonicus, followed by stiffness of the neck, difficulty in swallowing, and rigidity of pectoral and calf muscles.
Sympathetic overactivity (SOA) is common in severe tetanus and manifests as labial hypertension, tachycardia, dysrhythmia, peripheral vasculature constriction, profuse sweating, fever, increased carbon dioxide output, increased catecholamine excretion, and late development of hypertension. Neonatal tetanus is a form of generalized tetanus that occurs in newborns, usually those born to mothers who themselves have not been vaccinated. Local tetanus is an uncommon form of the disease, in which patients have persistent contraction of muscles in the same anatomic area as the injury. Local tetanus is generally milder. Only about 1% of cases are fatal, but it may precede the onset of generalized tetanus. Cephalic tetanus is the rarest form of the disease, 0.9-3% of cases, and is limited to muscles and nerves in the head.
An endospore is a non-metabolizing survival structure that begins to metabolize and cause infection once in an adequate environment. Tetanus affects skeletal muscle, a type of striated muscle used in voluntary movement. The other type of striated muscle, cardiac, or heart muscle, cannot be tetanized because of its intrinsic electrical properties. The diagnosis is based on the presentation of tetanus symptoms and does not depend upon isolation of the bacterium, which is recovered from the wound in only 30% of cases and can be isolated from patients without tetanus. A positive test result is the involuntary contraction of the jaw, biting down on the spatula, and a negative test result would normally be a gag reflex attempting to expel the foreign object.
A short report in the American Journal of Tropical Medicine and Hygiene states that, in a patient research study, the spatula test had a high specificity, 0 false positive test results, and a high sensitivity. 94% of infected patients produced a positive test. The booster may not prevent a potentially fatal case of tetanus from the current wound, however, as it can take up to 2 weeks for tetanus antibodies to form. For adults and children over 7, the TD vaccine, tetanus and diphtheria, or DAP, tetanus, diphtheria, and the cellular pertussis is commonly used.